From Maryland, Mr. Cummings.
Thank you very much, Madam Speaker. Madam Speaker, I am compelled to address this body tonight, having listened to my colleagues for over the last few days fabricate falsehoods about the Affordable Health Care for America Act. Every 12 minutes, an American dies in the greatest country on earth, simply because they cannot afford to live. Americans lie right now in their homes in pain, suffering because they cannot afford the care that would bring them relief. I meet people in my district who choose between medication and food, parents who go without medical treatment to pay for heat and clothing for their children, and family members who believe with all their hearts that a loved one has died because they lacked adequate health care. Like the misrepresentations about this bill, these injustices must stop. The time to act is now. In the words of President Obama, we must have the urgency of now. H.R. 3962 helps uninsured Americans immediately. It immediately creates an insurance program with financial assistance for those who are uninsured or who have been denied a policy because of pre-existing conditions. It also allows those who are unemployed to keep their COBRA coverage until the exchange is operational. Health insurance reform will mean greater stability and lower costs for all Americans. That means affordability for the middle class, security for our children, and responsibility to our children. It also will mean coverage for 96% of Americans. According to CBO, the bill reduces the deficit by $30 billion over the first 10 years. In speeches, Republicans describe this bill as the Speaker's bill. They call it the Pelosi bill. The bill does not belong to the Speaker, although she's done a phenomenal job in helping us to craft it. This bill belongs to the hardworking Americans that have insurance, but want a more transparent and stable health care marketplace that focuses on quality, affordable choices for all Americans and keep insurers honest. It belongs to 47 million Americans who are suffering with no help on the horizon. The bill belongs to the seniors living in rural areas all over our country who will receive better Medicare coverage because of this bill. It belongs to the children throughout our nation, so poor that their parents cannot even afford checkups. These are the children whose lives will be crippled by diabetes simply because a doctor has not diagnosed them as being at risk. Our children are our living messages we send to a future we will never see. The question is what type of message are we sending? They will suffer simply because they do not know how to reverse the symptoms leading them down the terrible road. The bill belongs to 44,000 Americans who die every year because they lack insurance. They have been guaranteed life, liberty, and the pursuit of happiness by founding documents my colleagues on the other side of the aisle constantly refer to. Americans are denied those things by the thousands. They cannot afford care, and so they die. That's right, Madam Speaker. For every page that the Republicans printed out and used as a prop, for every page, 22 Americans die this year because they cannot pay for the care that will save their lives. It is telling that they printed those pages out, Madam Speaker, using valuable tax dollars to make copies of a bill that is available and searchable and downloadable online. It is a perfect metaphor for the millions of dollars this bill will save Americans. Our health care system will save more than $150 billion every year, a call that President Obama made at the beginning of his campaign. The bill moves America to a health care system with an electronic record-keeping system, cutting fraud, excessive administrative costs, and medical mistakes. Republicans do not care about those savings or that progress. Like the pages of the taxpayer-provided paper used here today on this floor, they are props, only interested in being weights to drag down, slow down, and eventually stop true health care reform. pains me to say these words, but this is how I feel. With that, Madam Speaker, I yield.
The gentleman